Good morning, one and all. My name is Dr. Sivapragasam, Assistant Professor, Community Medicine Department, Science, Puducherry. Today's class is about maternal and child health. Uh, First, what we will see about why MCH is very important. What are the components of MCH? MCH includes maternal health, prenatal, antenatal, intranatal, postnatal services, child health, family planning, school health, handicapped children, adolescents, and daycare settings. So, how will you define antenatal care? Antenatal care can be defined as the care provided by skilled healthcare professionals. Healthcare professionals can be doctors, nurses, trained DIs, ANMs, anyone, to pregnant women and pregnant adolescent girls in order to ensure the best health conditions for both mother and baby during pregnancy. What are the objectives of antenatal care? Antenatal care objectives are promote, protect, and maintain health during pregnancy, detect high risk cases and give attention, foresee preventable complications, remove anxiety and dread associated with delivery, reduce maternal and infant mortality rate and morbidity, teach the mother elements of childcare, nutrition, personal hygiene, and environmental sanitation. Last thing is about educating the mother about family planning and MTP, medical termination of pregnancies. So always see to the red color highlighted points. First thing is promote, protect, and maintain health, detect high risk cases, foresee preventable complication, remove anxiety, reduce infant mortality rate, teach the mother elements of healthcare nutrition, and lastly, educate the mother about family planning and MTP. What are the things we see in antenatal care delivery? We see antenatal visit, prenatal advice, specific health protection, mental preparation, family planning, and pediatric component. Coming on to the danger signs of pregnancy. What are the danger signs of pregnancy? Danger signs include vaginal bleeding, persistent vomiting, fever with chills, dysuria, difficulty in urination, abdominal pain and cramps, swelling of the face and fingers, blurring of vision, dizziness, mental confusion, spots before the eyes, signs of severe preeclampsia. Preeclampsia is also called as pregnancy-induced hypertension. Oliguria, headache, leakage of fluid from vagina, marked reduction in intensity or frequency of fetal movements. This is a broad view of the baby growth. So initially you see about the first trimester. This is the first trimester. Next you will see about the second trimester. Last you see about the third trimester. This is the developmental stages of the babies. What is the history? Coming on to first antenatal services. First thing what we have to do is confirmation of pregnancy. In government, we have a NISHA UPT, urine pregnancy card test. Likewise, after the UPT test, you will do registration, or also called as booking of cases. So what are the ideal antenatal visits? Ideal antenatal visits is once a month during the first 7 months. 8th month, 2 visits, and 9th month, weekly 1 visit. So it goes beyond 10 visits, but ideally we can't have the 10 visits. So we have minimum visits. Minimum visit is 4 visits. First visit within 12 weeks, preferably as soon as the pregnancy is suspected. For registration of pregnancy, first antenatal checkup. Second visit between 14 and 26 weeks. Third visit between 28 and 34 weeks. Fourth visit between 36 and term. Third means 37 completed weeks. In ANC services history, what all the things you will ask? You will ask about complications during any previous pregnancy. If she is a second or third pregnancy mother, you will ask about the previous pregnancy history and current medical and surgical obstetric conditions. What is the last menstrual period? What's the expected date of delivery? Last menstrual period is the definition of the first day of the last menstrual cycle. History of any current systemic illness. Example, hypertension, diabetes, heart diseases, tuberculosis, renal diseases, epilepsy, asthma, jaundice, malaria, reproductive tract infection, STD, HIV, AIDS, etc. Coming on to the history, record family history of hypertension, diabetes, tuberculosis, and thalassemia. Family history of twins or congenital malformation, complication. If any complications like previous pregnancy complication, or also drug allergies and habits forming drugs. Coming on to physical examination. Physical examination, we see about pulse, pallor, respiratory rate, edema, blood pressure, weight. Weight normally should be 9 to 11 kgs. Ideally, after the first trimester, 2 kg per month. Pregnant mother should have at least 9 to 11 kg of weight gain and breast examination. Coming on to ANC services, abdominal examination. What are the things you'll see in abdominal examination? Abdominal examination you see first is fundal height. Fundal height in 12 weeks, just palpable per abdomen. In 20 weeks, fundus flat at the lower border of the umbilicus. In 36 weeks, fundus is at the level of Sivapragasam. I'll show next slide in the picture. Fetal ultrasound should be here in the fifth to sixth month. It's 120 to 140 per minute. Abdominal examination, you see about the fetal movement, fetal parts, fetal life, presentation, multiple pregnancy, and abdominal scar. So what all the grips? Now, abdominal examination, what all the grips you will see? First is fundal grip, next is lateral grip, next pollex grip, and last is pelvic. Fundal grip is to assess the fetal pole. Lateral grip is assessed to the line. Pollex grip to assess the presenting part. Pelvic grip is assessed for the engagement. So if you see in this slide, just find this is the fundal grip. At the height of Sivapragasam, you see the fundal grip. And these two, in the lateral side, you see for the lateral grip. This is the first pelvic grip. You use only the one hand. The second pelvic grip, you use two hands. This is the fundal examinations, lateral grip examination, as well as the pelvic grip examinations. So remember, in second pelvic grip, you see whether the head is engaged or not. If the hands are going outwards, that means the head is engaged. If the hands are coming inwards, that means the head is not yet engaged. So what are the lab investigations you see? Lab investigations you see at the level of subcenter, you can do pregnancy detection test, hemoglobin examination, urine test for presence of albumin and sugar, rapid malaria test. At the PHC or CHC or first referral unit, we can do blood grouping, including RH factor, VDRL, HIV testing, rapid malaria test, blood sugar testing, HbA1c for hepatitis. All these kind of tests you can do. And remember, in ultrasound, to know the correct gestation age, detect any abnormalities, lie of fetus, position of placenta, and amniotic fluid test. These are the things you see in the ultrasound. Mainly to see about, you do two scans, dating scans or anomaly scans. Dating scan is to tell about the pregnancy date. Anomaly scan is to tell about the any fetal abnormalities on like Down syndrome, any other symptoms are there. Prevention of RH incompatibility by giving anti-D to RH positive mother. Remember, if the mother is RH positive and the baby is RH negative, then the mother go for RH incompatibility. That means that after the first pregnancy, second pregnancy, if you don't give anti-D, all other pregnancies will be aborted. So remember, in the prenatal genetic screening for chromosome mortality, the screening for Down syndrome, all these things we will have to screen for the Down syndrome as also. Intervention and counseling. What are the intervention and counseling we'll see? As a pregnant mother, she should be given iron and folic acid. At least 100 days of iron and folic acid supplementation. Immunization against tetanus. 2 doses of tetanus injections at 1 month apart. Group or individual instruction on nutrition, family planning, self-care delivery, and parenthood. Home visiting by a female health worker or trained diet. Referral services where necessary. Inform the mother about Janani Suraksha Yojana and other incentives offered by the government. There are many centrally governed schemes are there, centrally and state government schemes. For example, in Tamil Nadu, we have Dr. Muthulakshmi Reddy scheme. In central government, we have Janani Suraksha Yojana scheme for the pregnant mothers. What constitutes a high-risk case? Remember, high-risk case, there are several factors. First, we will see about universal factor. Elderly pregnant, more than 30 years. If the mother is first time pregnant after the age of 30 years, that is called elderly pregnant. Or short stature, less than 140 centimeter. Next is medical disorder and complicating pregnancy, like all the systemic diseases, diabetes mellitus, cardiac diseases, thyroid diseases, hypertension, anemia, tuberculosis. Previous poor obstetric outcome. Previous poor obstetric outcome includes recurrent abortion, pregnancy loss, previous stillbirth, intrauterine death, neonatal death, previous preterm labor, preterm rupture of membranes, history of congenital malformation. What are the past obstetric history? Small for dates IUGR, large for dates history of LSCS, or myomectomy, preterm labor, pre-eclampsia, eclampsia, postpartum hemorrhage, manual removal of placenta. Obstetrical condition in the present pregnancy. What are the obstetrical condition in the present pregnancy? These include severe IUGR, intrauterine growth retardation, pre-eclampsia or eclampsia. Pre-eclampsia is nothing but pregnancy-induced hypertension. Eclampsia is pregnancy-induced hypertension along with seizure disorder. Multiple pregnancy, early pregnancy bleeding, antepartum hemorrhage, postdated pregnancy, malpresentation, and Rh negative mother. What healthcare system provides these services in India? In primary, we have in India we have three tiers: primary, secondary, and tertiary. In primary healthcare center itself, we have to cater all the antenatal services. Sub-center level, we give maximum, we'll give iron and folic acid supplementation. In secondary healthcare level, we'll have community healthcare center, rural hospital, as well as district hospital. Tertiary, we have specialist teaching hospital, medical colleges, and regional hospitals. All medical colleges are tertiary care centers. What are the things in private health center? Private, we have hospitals and clinics. Voluntary healthcare services. Voluntary healthcare services, Indian Red Cross also extends its hands in the implementation of antenatal services in some parts of the India. What is the national health program we have? We have reproductive and child health, mental and child health, integrated child developmental scheme, ICDS. ICDS is a very much pan-India program, integrated child development service. National family welfare program and child surveillance safe motherhood. In ICDS, we'll provide free food for children as well as free non-formal education, as well as mother, we can give some vocabulary training for mother. Who are the persons engaged in carrying out the services? Remember, at village level, ASHA, DAI, Anganwadi workers, these are at the village level. In type B, like sub-center level, we have 2 ANM, 1 health worker, 1 staff nurse, or 1 ANM, which staff nurse is not available. From PHC level, we have medical officer. Medical officer, auxiliary nurse midwife, health assistant. In CHC, that is community health center or district hospital, we have specialists like OG, pediatricians, like anesthetist. What are the advice you give for an antenatal mother? Remember, advice should be like about diet, personal hygiene, drugs, radiation hazard, warning signs, talk on family planning, facts and fictions regarding pregnancies. You have to give health education regarding the diet. Mother should have increased diet, as well as personal hygiene. Important thing is personal hygiene and drugs. What all the iron and folic acid tablets you should be taking to prevent from radiation hazards and warning signs. What are the warning signs? Talk on family planning. There should be ideally 3 years gap between 2 pregnancies. Facts and fictions regarding pregnancies. What are the myths about the pregnancies? Advice regarding breastfeeding to child and newborn care. Thank you. If any doubt, you can ask me.